Have you ever wondered why some women experience intense pain during their menstrual cycle, often diagnosed as endometriosis? Understanding the root cause of this condition could be a game changer. Endometriosis, as many of you may know, is a disorder in which tissue similar to the lining inside the uterus, called the endometrium, grows outside of the uterus. It's a condition that affects 1 in 10 women of reproductive age, and yet its causes remain somewhat mysterious. But let's dive into what we do know about the causes of endometriosis. Firstly, there's the theory of retrograde menstruation. This is where menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of leaving the body. Over time, these endometrial cells stick to the pelvic walls and surfaces of pelvic organs, where they grow and continue to thicken and bleed over the course of each menstrual cycle. Another cause could be a process known as metaplasia. This is a complex term for a simple process. Metaplasia is when one type of cell morphs into another type. In the case of endometriosis, it's thought that certain cells outside the uterus transform into endometrial cells. Then there's the idea of an immune system disorder. In this scenario, the body's immune system fails to find and destroy endometrial tissue growing outside of the uterus. This could be due to an immune system disorder or a lower immune response. Lastly, we have the theory of endometriosis being a genetic condition. Research indicates that it can run in families, suggesting a potential genetic link. So, to summarize, the causes of endometriosis could be linked to retrograde menstruation, metaplasia, immune system disorders, and genetic factors. These are the most accepted theories, but remember, every case of endometriosis is unique and can be caused by one or a combination of these factors. The complexity of this condition is a clear call for more research and understanding. By understanding more about the causes of endometriosis, we can hope to improve the diagnosis, treatment, and support for the millions of women affected by this condition. And that's a wrap on the causes of endometriosis. We've untangled some complex theories and hopefully made them a little easier to understand. It's a small step on the road to better understanding this condition that affects so many women worldwide.